Good evening and welcome everyone. I am Lauren Gates, your host of this evening's Airway Health Solutions Conversation Series, and we have our special guest and faculty, Brittny Murphy, and two guest appearances by Dr. Kevin Boyd and Dr. Ben Miraglia. They'll be joining us later. So tonight's conversation is pretty much a town hall format where we answer all questions myo. So welcome, Brittny. We're so thrilled to have you back for the new year to kick off our conversation series. A lot has happened for you in 2024. I just want to congratulate you on becoming a new mom of twins, and we'll get to like the nitty-gritty of your bio and all, but I just have to showcase these little darlings and your beautiful family. So let me just go ahead and share these little miracles that you have, and we're so happy for you. And we'll talk about a little bit more about how that affects your journey as a myofunctional therapist, and a mom now. And we'll talk about that a little bit more in discussion, but really, we're so thrilled for you. And if we hear some crying in the background, we will understand, because
yes, please do.
Because that's just the way it is, and we're live. So that's the way it goes. So I want to go ahead and give you a formal introduction, and then we'll also see who's joining us tonight. I'm so thrilled that, again, we have close to 600 registered this evening. So that really shows the interest in myofunctional therapy and how the interest in just our airway health movement. So thank you, everyone, for attending this evening. So Brittny Murphy, RDH, BS, COM, QOM, is a pioneer in the field of myofunctional therapy, known for her expertise as a registered dental hygienist, educator, author, and key opinion leader in sleep and myofunctional therapy. She's a certified oral-facial myologist and Boteco breathing educator. Brittny earned her degree from the Forsyth School of Dental Hygiene at MCPHS in 2011 and postgraduate training in oral-facial myology in 2016. She has since become a driving force in advancing the field. Brittny is also the founder of CT Oral Facial Myology and hold on, just jumped a minute. Of myology, and co-founder of MyoAir, two highly successful private myofunctional therapy practices dedicated to improving oral health and whole body wellness. Through these practices, she has, sorry, it's jumping on me here. I'm going to your other bio because this is like jumping around in the chat.
No worries.
And you have so much good stuff to share that I have to say.
I could finish my bio if you want me to.
It's okay. I got it here. It was in the chat and it was jumping all over the place. So it was kind of a fun exercise. Okay. Through these practices, she has empowered hundreds of patients to achieve better breathing, sleep, and overall health. In addition to her clinical success, Brittny is an educator, and we're proud to have her on the faculty of Airway Health Solutions, where she trains healthcare professionals to become skilled myofunctional therapists. She also co-directs the myofunctional therapy program at Toothpillow and is on the board for the IAOM and hosts the widely recognized podcast I Spy with My Myo Eye, where she shares her passion and knowledge with a global audience. Through her innovative work, Brittny continues to inspire her patients and pave the way for the next generation of myofunctional therapists. So with that, welcome, and we're thrilled to have you and answer all our questions. But before we do that, let's see who's joining us tonight. I always like to see of the 600, how many are with us, and also what profession everybody is. So please go ahead and take a second to fill out the poll and tell us your profession.
These are always so exciting.
It's so interesting because depending on the topic, it varies. So, and we're sorry if we don't have every specialty in here. We try to do as many as we can. Sometimes we have a couple of parents and patients. If you don't see your profession, you can please add it to the chat. We'd love to welcome you. Okay, we're 81% participating. Well, dental hygienists win this one, but I love to see all the dentists on board as well, and everybody. Thank you for joining us tonight. It's going to be a great night because there's so much mystery about myofunctional therapy, and I'm thrilled to just kind of roll up our sleeves. You can use the Q&A box. There's not a formal presentation tonight, so we have plenty of room to answer all of your questions. But let's start off with kind of something basic, like what is myofunctional therapy, Brittny?
It's always a good starting point.
Yeah.
So, when I talk about this, I kind of always like to give like the technical definition and then an easier way to explain it to your patients. You will hear a lot of people use the term that it's kind of like physical therapy for the mouth. Being a dental hygienist, I don't really love to use that term because I feel like I'm kind of practicing out of scope. So I kind of like to compare myself more to like having a personal trainer, right? Like you're going to the gym basically for those muscles below the eyes and above the shoulders. That's an easier way to explain it to your patients. Now, theoretically, it is the neuromuscular reeducation of the oral facial muscles. Now, the reason that term neuromuscular is so important is because when you use that gym analogy, everybody's next question is, well, am I going to have to do this for the rest of my life? Because we all know what happens when we stop going to the gym. We're not looking too good. But that neuromuscular reeducation, it's really helping to carve new neural pathways between the brain and the muscles. So that's why we're creating those sustainable lifestyle habits. Regardless of who we're working with, we have certain goals that we want to reach with our patients, and that's establishing dominant nasal breathing all day and all night. So in and out through the nose all day and all night, creating a palatal tongue rest posture. So getting that tip, middle, and back of the tongue lightly suctioned in the roof of the mouth like this, having our lips closed. And again, these are postures we want to hold all day and all night. We also want to talk about the importance of a dental freeway space, and that's basically the space between those back teeth. We want that to be about 2 to 3 millimeters. So regardless of who we're working with, those are our goals by the time they graduate from our program.
Wonderful. And how did I forget to share this tonight? But we have some special surprises as well for our audience. We actually are going to kick off with some special giveaways, being that it's the beginning of the year and there's so much interest, especially from the hygienists and SLPs and the allied healthcare professionals and the dentists and pediatric dentists of wanting to learn more about Myo. We're giving a free spin the wheel raffle tonight for a free course to the intro of Myo course. So that's a $3,000 value. So you have to stay to the end to receive that. And we are also feeling very generous tonight. We want to get as many Myos on board as possible to serve the needs of kiddos all over the world, even virtually, that we are giving 50% off all our Myos tonight, only for you guys who are on live tonight. And then also you have to be here at the end, and we'll give you the code at the end, but it expires at midnight. So 50% off. We've never done this before at AHS.
I don't know that I've ever seen really a 50% off deal.
No,
So
no.
I would take advantage of it.
You can tell your friends right now, have them log on. This is the window of opportunity. But they need to be on. We have the attendance list. You can't just share the code. We cross-reference. So we're thrilled to offer that because there's so much to learn, and we are so appreciative of you coming here and spending time on your Monday. Is it Monday? No, Wednesday evening with us to learn more. So the other thing I want to let you know is to receive your CE certificate, you must be in attendance as well for the entire program, and Zoom software tracks the attendance. So we do not need to give you a code or a survey, and please allow about a week to give our operations a time to give you that certificate, and check your spam from info@airwayhealthsolutions.com. And I don't know if we need to do the disclaimers because it's a Q&A, but I guess it doesn't hurt, right? So here we go. Okay, let me do this as fast as I can, and all the myofunctional therapists can watch me as I read. All righty. The views presented are the opinions of our speaker and are not necessarily affiliated with Lauren Gates and Associated and Airway Health Solutions. The following webinar is provided for educational and informational purposes only, does not constitute providing medical advice or professional services, and the information provided should not be used for diagnosing or treating a health problem or disease, and those seeking personal medical advice should consult with a licensed physician or a dentist. Always seek the advice of your doctor or other qualified health provider regarding a medical or dental condition. Okay. So we got the housekeeping stuff done, and we're thrilled to be able to provide everyone those perks at the end. So please stay with us to the very end, and then we can all get rocking and rolling with this. So the first question I asked is, what is Myo? The second question would be who can do Myo?
So I would say a majority of us myofunctional therapists are definitely either registered dental hygienists or speech language pathologists, but we also have PTs, OTs. I've seen a couple nurses, other allied health professionals. Dentists, technically can also be myofunctional therapists, although I think that their time can be better spent doing other things, and better to, train your dental hygienist in your office to be able to provide those services. Did I miss anybody? PTOT, speech, RDH? I think I got them all.
Okay, and let's talk about why you wanted to become a myofunctional therapist. So you're a registered dental hygienist, and let's just talk a little bit about your journey because you're such a successful therapist and successful business person, as well as an educator and lecturer. So why don't you tell us a little bit about your aha moment of why you became a myofunctional therapist, and if you have any regrets?
Oh gosh, no regrets. No regrets at
Okay,
all.
good.
But
That was it. I was hoping you'd
I
say that.
yeah, I don't have like your typical why'd I get into myo story. I guess mine was a little reversed. Like typically, myofunctional therapists get into this field because they have somebody close to them that has an airway issue. And I guess that wasn't really my aha moment. I read an article in an RDH magazine by Joy Moeller, and that was my aha. And all these light bulbs, she talked about helping patients with migraines, helping patients, with clenching and grinding, and, thinking about those patients that are constantly calling because they're breaking crowns, and like that there's a reason for that, and I always talk about this specific patient. Um, he 1,000% had obstructive sleep apnea, and it wasn't something that we ever knew to screen for, but I can picture his mouth, like his tongue, massive tongue, scalloping, completely worn down dentition, always calling because he was breaking crowns. And we were like, okay, what did Mr. So-and-so chew on today? And never, really getting to the root cause, just keep restoring the mouth. And so I always wanted to further my education. I'm always looking for ways to help my patients further. And when I read about it, it just was so intriguing to me because it wasn't something I ever heard about. We don't learn this in hygiene school. So I kind of dived a little deeper online, learned a bit more about like the fundamentals of Myo. I reached out to a few local, well, I should say more than a few local providers to see if they heard of Myo. Nobody did, except for one orthodontist that was in town, but one provider was enough for me to be like, you know what, I'm just going to go and do this. At that time, a majority of the courses were being hosted internationally, and it just wasn't in my budget to unfortunately be able to do that. And I felt like it was fate because the AOMT popped up at NYU. They were offering a 4-day course in New York. I'm in Connecticut. I'm like, okay, this is too good to be true. I feel like this is a sign. So I went, I took the course, and that is really where all those aha moments, those light bulbs started going off for me. I remember specifically thinking about my nephew who was just born that had a tongue tie. And I'm like, oh my God, like this is literally my nephew. And then, of course, you're thinking of that laundry list of family members, friends, patients that you can go back and help. So that's how curiosity is really just what got me into myofunctional therapy.
I love it. Forever curious. And Dr. Susan Maples is with us. She has a question in the chat saying, my whole team is greatly appreciative of our ability to work with your incredible team virtually, from
Aw,
short
thank you.
projects like pre-release exercises to longer-term airway challenges. So thank you for that. Question is, what is the earliest age you can comfortably work with? And at what age do you need mom or caregiver to participate? And at what age do you like the child or teen to work with you directly without the parent?
These are all
Great
very good
questions.
questions.
Mhm.
Yeah. So, what is the earliest age you're comfortable working with? So, they have to have volitional movement. They have to be able to cognitively understand what it is we're asking of them. Typically, when you're working like a full myofunctional therapy program, you're going to work on swallow, which is a pretty complex skill to work on. I would say definitely by age 5, we enroll them. Some 4-year-olds, we can enroll into a full myofunctional therapy program. Again, it's going to depend on maturity, parent participation, compliance, things like that. However, we do offer what we call mini myo, more for that 2, 3, 4-year-old age range, where we can start to build those foundational skills and really just work on strengthening the muscles of the oral facial complex. But as far as a full myofunctional therapy program, I would say definitely by 5, some 4-year-olds. At what age do you need mom to participate? So I really like the parents to be involved regardless of the child's age. Now, that doesn't mean I always have the parent sit in on the call, because even some 7-year-olds do very poorly behaviorally when parents in the room, they tend to act up. So just like we do in our hygiene chair, we politely ask the parents to wait in the waiting room. But I do think that it's important that the parent comes in at the end and understands exactly what is asked of that child, really regardless of any age. Knowing what we're trying to accomplish this week, what are the exercises, if there's, any troubleshooting that you had to give them, certain things that the parents can help with. And then what age do you like the child teen to work with you directly without the parent? Okay, so I think I kind of answered that. I mean, teens, typically the parents never in the room unless, they want to be, but I still always give the parent a summary. If it's a virtual appointment, I'll have mom or dad or caregiver pop back on the screen and say, we worked on X, Y, and Z. This is what I'm expecting, and just so that we're all on the same page. I also have families sign it's basically like a consent that they're going to be compliant with their exercises. And so they understand that if they're not compliant, we're not going to see the results we want to see. I also, we have that conversation from the very beginning. And it's just so important because unfortunately there are families that think, they're going to unfortunately throw their money at the problem and like that's going to do it. And myofunctional therapy is a very compliant based therapy. We even give like weekly reports for how well they did in that week's worth of exercises, like 95% compliance, 20% compliance. So that way, if anything ever arises, we're able to kind of reference that report. So no matter the age, parents, I do think need to be involved.
Right. And with a toddler that had an infant released, what can be done to help until he or she is old enough for myo?
Yeah, so I think that it depends what their symptoms are, but typically when I have that age range that I don't feel comfortable working with, I'm usually referring to other teammates on our team, right? Occupational therapists, feeding therapists, myo munchies can be a really great adjunct, depending on, again, maybe they're ready for a myofunctional guidance appliance, but they're not quite ready to enroll in this compliant-based program. We'll definitely try to get them connected with somebody. Body work would really be huge for that toddler, especially if they're still having issues, to see if they can manually work through, some of that tension. But I would say my go-to would probably be a pediatric OT.
And so interested to hear how myofunctional therapy helps with breastfeeding.
So you can't do myofunctional therapy with a infant, right? That is breastfeeding. However, breastfeeding is like the most natural form of myofunctional therapy because what has to happen in order for that baby to efficiently and effectively extract the milk, that tongue really has to be pumping. We have to have that nice posterior action of the tongue in order to, again, be able to efficiently extract the milk. So when we're working with infants, that's going to be more in the realm, again, of a feeding therapist and IBCLC. So I can talk a little bit on this because my babies were, let's see, they had their posterior ties released, their upper and lower labials released, their upper buccals released. And being a myofunctional therapist and knowing all that I know, I'm like, oh, this is going to be easy. It's going to be the best breastfeeding journey ever. And like that didn't happen. Luckily, I was, of course, armed with the knowledge that I have, and I was able to connect, with the right providers. So I worked with an IBCLC even prior to having my babies because I had twins and I wanted to make sure I had was going to be able to establish a good milk supply for both of them because that was very important to me. And then after the release and the body work and the IBCLC, we still were having struggles. And that's when I got connected with a local pediatric feeding therapist who I cannot say good enough things about. I really feel like she's the reason that I'm able to breastfeed today.
Wonderful. And look at that little tongue.
Emotion.
Oh my gosh, I can't. I had to bring that picture back up because I was like, how did you get her to do that, little C?
And they're always doing what we call this a cave.
Yeah.
In myofunctional therapy. Sciarra, for whatever reason, when she does like her big, massive smile, she's always like that. And I need to take a picture and post it on my social media page. But yeah, it doesn't just naturally come. And, my babies were born premature. So feeding was the toughest thing. That's why we were in the NICU for as long as we were. And even knowing what I know, I mean, when you're going through it, it is stressful. It's almost like when I saw the IBCLC, the pediatric OT, I'm like, talk to me like you don't know that I'm involved in this field, like because my
Right.
brain was so scattered. But the other thing that I want to touch on, because this comes up a lot with babies and myofunctional therapy and growth and development. If you had asked me prior to having my babies if my babies were going to have pacifiers, the answer would be absolutely positively not, never, no way, no how. At my baby shower, I was like, they will never have these. They actually don't currently take pacifiers. They literally just won't take them. But when we were in the NICU, and we were really struck. They were on the feeding tube. They did not start taking from the bottle until the nurse introduced the pacifier. And at first, I was a little hesitant, and it just really helped them coordinate their oral musculature. And through my work with the pediatric OT, for those of you that aren't familiar, this certain pacifier, it's called a Nini pacifier. Um, it is a therapeutic pacifier. So again, it's not that I was giving my babies, unless they wanted them to soothe themselves, pacifiers, but there was a therapeutic reason for them to be using these pacifiers. And prior to experiencing this with my twins, I didn't think that pacifiers ever had any pros. So I kind of like to just talk about that now because that was something that I learned through this journey.
Can you elaborate on what exactly body work is? Is that chiropractic that you were referring to?
Yeah, so body work can be chiropractic. It can be seeing a cranial osteopath. My baby saw a cranial sacral therapist who has a background in occupational therapy, but it can be chiropractic work. It can be massage therapy. It could be myofascial release. Really, it's any kind of hands-on manual therapy is what I mean by that.
Do you have concerns with the pacifier use after the age of 2 that would confuse the muscles?
Yes. I mean, honestly, I think by 6 months, we should try to get the pacifier gone, right? They say that pacifier in the first six months can reduce the risk of SIDS. After that, I don't really think that there's much benefit, but definitely by age 2, we want to get rid of the pacifier.
And can you please share which infant feeding specialist you used?
So her name, I always say her last name wrong. It's Julia Marville, Marvil. She was fabulous. Her company name is, I also don't want to screw this up. I think it's called, I think it's literally just called TOTS. Let me just look at my phone quick. She
Sure.
actually moved from Atlanta to Connecticut. Yep, TOTS Therapy is the name of her practice. She might even be having her baby as we speak. I know she's due some point in January, but she really helped provide me with tools and stretches and exercises beyond what I was doing, just like post-release wise. That really made such a difference for my babies, their tension, their latch, everything.
How do you recommend incorporating Myo into patient education that does not take away from oral hygiene instruction? I guess the time concern.
So, I actually just did an episode on this. So I think that you're busy in their mouth, right? So there's a good amount of time that your patient really can't talk to you. You can kind of just explain the process of first and foremost introducing this new concept, right? It's going to be the first time that you're conducting a airway screener, a myofunctional therapy screener on them, and just kind of explaining what it is, being as informative as you can, as gentle with the information as you can as well. You don't ever want it to come off like, salesy or you're really, pushing, that certain service on them. But you are already in that area, especially hygienists, for 45 minutes to an hour at a time. I promise you, look, I am a hygienist. I don't want to do anything that's going to add on all this crazy amount of time to your already very, very busy time. You're already there. You just have to document a few other things. You're already looking at the oral pharyngeal space. You're already looking at the tongue. So check the mobility, check underneath it. Palpate a few extra muscles while you're doing your EOE, IOE exam. It really does not take long to conduct an airway screener in the dental hygiene appointment.
Great. I'm trying to gather some of these questions together, but what is your conversation with a parent who is having a hard time decreasing pacifier use in a child over 3?
What is my conversation with the parent? So we have habit.
Yeah.
Yeah. So as a myofunctional therapist, you will have habit cessation programs in your practice. And one of the tools I like to incorporate a lot at that age, with the pacifier especially, is a myo-munchie. You really want to replace the habit with something positive, but is still going to give them that feedback, that oral stimulation and feedback that they're looking for. Um, you always want to have the conversation, of course, with the parent ahead of time. Let them know exactly what it is you're going to do, recommend, speak with the child about. Sometimes, like, you also have to get rid of whatever is associated with that habit. So sometimes, it could be like a lovey is associated with the pacifier where they're kind of rubbing like the stuffed animal on their face or something. And when they get that stuffed animal in their hands, they want the pacifier, the thumb goes in their mouth. So it's really important that you're looking at the whole picture. And sometimes, honestly, what we do, as long as the parent's okay with it, is we kind of just say bye-bye to these pacifiers. We can say, like, Passy's going on a trip to Disney World or something. And something that I'll have parents do, because nighttime especially is really, where children tend to want to do these habits the most, where I'd recommend, going to the dollar store, getting a bunch of tiny little toys, leaving a toy for the child underneath their bed so that every night they have something positive to look forward to. And it's not like them freaking out that they're not going to be able to have their thumb or, their pacifier with them. But the Myo Munchie is definitely a good replacement for the pacifier.
And how do you help autistic children, or do you work with autistic children with myofunctional therapy?
Yeah, so definitely, you have to have the conversations with the parents that the progress is going to probably be much slower. I would probably also encourage you to have the conversation that you might not 100% reach all of those goals. Really, what you're trying to do is optimize things, right? And get them farther along than where they were when they started with you, strengthening those muscles, encouraging nasal breathing, implementing nasal hygiene. You definitely want to build a good rapport with those patients. Definitely find out their likes and their interests. So you want to be friends with them. You want them to feel comfortable. You want them to trust you. Having bright, fun colors in your office is another good thing. Always, if you're introducing different tools or utilizing tools in your myofunctional therapy kit, explaining them to, the child, having them touch them and really get familiar with the different textures is really important, like for sensory reasons.
What are the most common conditions treated with myo?
Oh my gosh, I feel like
I
everybody needs
know.
myofunctional
I
therapy.
know.
Um, okay, I would say one that stands out the most, that is easiest to be like, you need myofunctional therapy, and you'll see it all the time, is mouth breathing. You'll see this, I mean, literally after we finish here, go turn on your television and look at the amount of actors and actresses on there that have open mouth posture, that have a flaccid and rolled out lower lip, that are mouth breathing. I would say recessed jaws or just insufficient like craniofacial development. When we think about structure, we also have to think about function, and structure and function go hand in hand. You really can't have one without the other. And when we look at the root cause of like these underdeveloped jaws, it's really that soft tissue dysfunction.
Okay. How can a hygienist do a screening if we don't know much? It's not like how do they do the screening? It's, I guess, how do they learn is really the question I'm hearing.
Yeah, absolutely. So, I have a private Facebook group called the Myo Hygienist that I strongly urge you to join. Um, we give out little, mini lectures in there. I have a little podcast that's going where weekly I'm kind of going through basically different questions that I get from hygienists on the regular, and how you can start to implement these, protocols into the practice. I think that taking a course, I think even if a registered dental hygienist does not want to be a myofunctional therapist, you don't have to become a therapist. I think that every dental hygienist can benefit from taking a myofunctional therapy course so that you understand how to spot airway, how to refer, who to refer, when to refer. And definitely look back at Airway Health Solutions, all of these prior conversation series that Lauren has. It's a wealth of information, guys, and it's free. Like, they're all in on the website under, I don't remember what the tab that it's under, if you wanted direct.
Oh, yes, it's conversation.
Yeah. But that's one of the really great things about everybody in this space is we really just want to build that awareness for the public and professionally. So there's so much access to free education out there. So podcasts, YouTube lectures. Just Google, reach out to me. I will help direct you where you need to go.
Great. And I took the AOMT course and I never practiced, but I benefited so much just from learning. It's just a whole new world and your perception is just wider. So everything actually is easier to understand when you have more of the pieces of the puzzle in place. So
Yeah.
you can see the whole
Absolutely.
picture.
And even like myofunctional therapy, aside from overall body wellness, it's obviously also going to help oral health. So even your patients, like think periodontally, those patients that, are coming routinely for their perio maintenance and they still have active disease. What is going on here? There's a big link between patients with periodontal disease and airway issues. And a lot of these patients aren't ever getting screened for any kind of sleep disordered breathing.
Okay, let's get some from the chat here. Let's see, what is the best way to get into Myo if I live in a small town and or don't have a dentist who believes in it?
So that's also a great question. So I would say don't let that you'll find your tribe. It's going to take a little bit. You definitely, the power of networking is really important, getting yourself out there. You also can do this virtually. So when I first became a myofunctional therapist, there still are very little airway providers in Connecticut. I mean, we have some really good ones, luckily, but there's not a lot. And I networked with dentists across the United States. Like we treat patients globally. So that's something as a dental hygienist that you're able to do is treat patients really wherever they are. So you are able to, if you come on another one of these conversation series and you meet one of the dentists that lives in Ohio and you're in Colorado, you can see their patients. Like Dr. Maple said, I see her patients virtually and we're nowhere near each other. So that, and then what was the first part of the question? It was, what should I
Like their dentist, hold on, the dentist. I
Sorry.
know I took it out. Yeah, I think they were saying if their dentist, they don't have a dentist near them that believes in it.
Oh, yes. So that's the other thing we're going to touch on tooth pillow tonight, but tooth pillow, you're going to be able to be a myofunctional therapy provider for tooth pillow where you can refer your patients to tooth pillow to be evaluated by an airway doc. We have doctors across all throughout the United States. If they need to be seen even in person, we're able to get them hooked up with the closest provider to them. But there is that option and it's completely virtual. So these families don't have to be an hour away from or within an hour radius of an airway provider. All of this stuff can be conducted virtually. And I know we're going to get to that a little bit later. So keep that in your back
Yeah,
pocket.
but I'll put the website in the chat just so people, and we also had a whole conversation on tooth pillow in the archives. We'll put that link in the chat as well. But our goal is to have every child and every adult, actually we'll get into adult Myo in a moment, have the care that they need, right? So this
Yeah.
happens all the time. We get these questions all the time with lack of access of care. So we're really excited that we do have some solutions here with tooth pillow and getting more providers.
I
We
like
have
this. Can
army.
I read this next question, Lauren,
Sure.
that I'm looking at? Because I get this all the time. It says, do your courses involve both child and adult patients, or are you more child-based learning? I have many adult patients with airway issues and would love to learn more, all age ranges. That is a very common misconception about myofunctional therapy, that it is only for children. That is not true.
Mhm.
The oldest patient that I have worked with was like 82 years old. So yes, it is definitely geared more towards children and adults. You're going to see always a lot of emphasis on pediatrics because of course the earlier we can catch them the better. I mean, we could completely change the trajectory of these children's lives, but we're not going to leave those poor adults that got missed behind. There's definitely a lot that can be done from the functional standpoint as a myofunctional therapist, and then the structural standpoint as well with a airway dentist.
And a lot of questions revolve sometimes about getting paid, as a profession. So is myofunctional therapy covered by insurance plans or do patients pay cash? I know you get that all the time.
Yes. So, unfortunately, myofunctional therapy is typically not a covered expense. Um, I am a dental hygienist in a private practice. I cannot bill insurance as a registered dental hygienist. So we do provide super bills to patients, which a super bill, for anybody that doesn't know, it's like a very, very detailed, almost like receipt kind of like invoice. It has diagnostic codes, procedure codes, confirmation patients made payment. And they would kind of send that into their insurance on their own. I will say over the last probably like 3-ish years or so, I have seen more families get something. Sometimes what their insurance will say is like, if there isn't a provider that does this service within a 50-mile radius, sometimes they can get coverage that way. I'm forgetting the actual technical insurance term that they call it, gap exemption. That's what it's called. But typically it is not covered. So, you can have payment plans. We do accept like health savings accounts, FSAs, HSAs. We're always trying to work with patients so that they can get the services, that they need.
Okay. Oh, let's see. There's so many great questions here. I think we're gonna have to do another one of these. But it's so great. I love this one. It's a good side hustle for hygienists. The side hustle turned into a whole career for you that you can't imagine not having. It can
Yeah.
be. It really depends on, like anything else, what you put into it.
Oh my God, absolutely. And like I said, if you asked me whenever I started this, a decade ago, if I was not going to be doing clinical hygiene anymore, I would have thought you were crazy. It was something I just was going to do on the side. And I was like, oh, let me just see where it takes me. There are so many patients out there that need myofunctional therapy, and there are not enough of us. And what's really great, and I know this was another question that we had that came in, was it's such a great lateral transition for a dental hygienist because you're still able to use your skills and your education and just expand upon that. And what you're going to learn in any airway course that you take is going to completely change your patients' lives. Just simple conversations that you can spark while they're in your hygiene chair. So, I don't remember what the initial question was now. Sorry, guys. This is my mom brain. It's late at
No,
night.
that's okay.
My brain's like
Good
short
side.
right
I was just
now.
talking about a good side hustle.
Side hustle. Yes.
Yes, this is a great question. Are there any key points that seem to click with parents from your experience as to why myofunctional therapy is beneficial? Some parents don't follow up on referral from Myo at the hygiene recall, and how can we persuade the need and benefit for a parent that seems unsure?
So I think one of the bigger ones I think is like behaviorally. There's so many kids that, get diagnosed ADHD or labeled ADHD, and nobody really ever looks at the way these kids are sleeping. And there's a big overlap. And Dr. Miraglia is a wonderful person to talk about this because he can quote all the research. I can't. But there's a huge overlap between children that are diagnosed with ADHD and have an underlying sleep disordered breathing issue. And the symptoms are going to look the same. Like, for us as adults, when we're tired, we're lethargic. Like, we don't want to do anything. We want to just hang out and watch Netflix. But when a child is extremely tired, it's almost like they get hyperactive because they're trying to basically keep themselves awake. And these kids, unfortunately, don't excel academically. They get in trouble a lot at school. And again, it's something as simple as just screening for airway. And these type of things not only, of course, should be done in our dental offices, but really in pediatrician offices as well.
Absolutely. And I know Dr. Morelli, I don't know if he can join us. And I just pinged Dr. Boyd if they want to come on camera. I think it's a good time to introduce kind of how they utilize myofunctional therapy in their practice. So I just pinged them. Maybe they'll come on in a moment. I'll ask another question. Here's Dr. Boyd. I see some movement. He's alive. I know he's probably eating dinner. Dr. Boyd, thanks for coming with us. I love your passion for this. I know you're probably the biggest myofunctional therapy fan out there. One of them anyway that I know. We were talking about, key points that seem to click with parents as to why myofunctional therapy is beneficial. Perhaps you can chime in on that. And also welcome Dr. Miraglia. We have the squad here. So I don't know who doctors who are more passionate about myofunctional therapy than the both of you. So if you would just share your thoughts on myofunctional therapy and maybe some key points of how to get parents on board, that would be really helpful.
If I could just establish and then turn it over to Ben,
Sure.
but I've come up with a hypothesis, and I have lots of evidence to support it, is that any child that or adult, glad you mentioned that, Brittany. By the way, you're a great communicator. You're doing such a great job of conveying the importance of this. Um, I pretty much know when people come in to my practice with a kid who, has malocclusion and sleep and breathing problems, or maybe they're not obvious. If they have malocclusion, even if it's subtle, they have a myofunctional disorder. They have an OMD. They must have. And what you coined tonight, Brittany, mouth breathing, habitual mouth breathing, is a myofunctional disorder. OMDs, that's Linda D'Onofrio's paper is so brilliant on that. But there would be no malocclusion if there weren't persistent myofunctional disorders. And I really, my career is just based on that right now. So I'd like to establish that, and hopefully it's supported by, you, and I know Ben supports it. And so that's really all I really want to say is, if you've got a kid coming in that needs expansion, you've got myofunctional disorders. If you've got a kid coming in that doesn't have a chin, you've got myofunctional disorders. If you've got a kid who's growing long face, adenoid face, you've got myofunctional disorders. And you need a qualified myofunctional therapist to do treatment. But like you, brilliant. I'm so glad you said this, Brittany. You don't have to be qualified to treat, but everybody must do risk assessment. But they're not teaching it in the hygiene schools. It's a part of hygiene. Hygiene means health. It doesn't mean clean. And I wish they changed the name to dental hygienist to oral hygienist. You're the whole mouth, the whole body, but dent mean, oh, you clean teeth. I mean, they call me a dentist. Oh, you just work on teeth. That's it. The ADA under Steve Carstenson's guidance, we want to change that whole thing to oral health. We're oral health professionals. We're not dental health professionals. So that's all I want to say. Ben, take it over.
We're glad
man.
you said it, and thank you. Thanks for coming on. Dr. Miraglia, you want to chime in on that?
Yeah, good evening, everybody. Three of my favorite people. Oh my goodness. So I could listen to all three of you all day long. I don't want to jump in and say too much because following Brittany and then Kevin is a very hard act to follow. But yeah, Brittany, thanks again for a wonderful presentation. The information is priceless. I totally appreciate Kevin's support me. Meanwhile, I'm following him around like a stalker because I can't learn enough from him. And yeah, he's an early mentor of mine, and I try to be as much like him as I possibly can. Then I know I'm helping children in the right way. But yeah,
the feeling's
I can't help
mutual,
it.
very mutual.
Thank you, buddy.
It's a love fest. Everyone press their hearts right now.
I can't help it. I can't help it. I just have to say that I believe every child needs attention. It's hard to find one that doesn't. I'm tired of saying almost all. It's so weird to say almost all, because what kid have I met that didn't need help or attention? I just don't see it. I don't meet children who are fine and growing well and healthy and not struggling. And if you have mild symptoms, you still need attention. So something mild is not okay. So I really feel like I'm stuck in the camp of every child needs attention, and the earlier the better. I'm glad Brittany mentioned body workers and things you can do earlier, because I jump in at 3. So like Kevin says, I treat the geriatric child population. I go in there late, but he gets in even earlier. And yeah, with the myofunctional therapy, speech language pathologist, everybody else involved, the body workers, lactation consultant, all these people are getting involved from birth. That's really where it should start. And so, yeah, I'm just happy there's a big community out there of people jumping in early, and then, help that child along the way, because we kind of know what the Western lifestyle has delivered. An unhealthy child by 3 is what I'm seeing. And yeah, the sooner we can get in there, the better.
A question for all 3 of you, maybe we could just do a quick round robin, is how do you navigate pediatricians not agreeing with lip tongue ties and not being on board with Myo? Is there I know it's a big question, but can we kind of have a shorter answer? And I'll start with you, Dr. Miraglia. Oh, wait, Dr. Boyd, you raised your hand, so you go first.
Well, I want to get it in and then get out and listen. But in my experience, you said pediatricians, and I get it, but all you need is one. And you know what? Keep documenting what you're doing. Keep asking to communicate. Email, I'd like to speak. Could you set up a time for me to share this with you? But You don't need a bunch of them. You need one. You need one pediatrician or a, you know, general practitioner. They're family practitioners that see kids and adults. All you need is one, and then it's going to turn into two, but all you need is that one go-to. It's the same thing with an ENT. You don't need to convince all the ENTs. You need to convince one. And it takes a
But
while. It's taken me years. Just be patient and keep on doing what you're doing. But you're just not going to change that. And you weren't always this way. Lauren, Ben, myself, we didn't come out of dental school this way. We weren't born, it took us a while. I thought myofunctional therapy 15 years ago, I thought it was voodoo. I thought it came from like the bayou. It's witchcraft. And little did I know, I am so dependent on people understanding the connection between myofunctional disorders and malocclusion and respiratory problems. So it just takes a while. Just remember your roots. You weren't always this way. You haven't always been this informed. Put yourself in the position of the pediatrician. They don't know that. They didn't learn this in medical school or their fellowship training, but it takes an enlightened person like yourself. You're going to be the one, and then they're going to hear it from somebody else. So that's how I feel. It's a
thank you.
principle.
Thank you, Dr. Boyd. Brittany, you want to jump in on that one? Because I know you have established a nice referral system.
Yeah, I think, I always say to parents, like, I would love to have a conversation with the pediatrician. So trying to get, a hold of them to just have that conversation, that open conversation and just explain, a lot of providers are very surprised when they see a myofunctional therapist's evaluation report to see all that we actually assess and look for. And when I'm sending evaluation reports to providers that aren't yet on board, I make sure to include research in there to back up, whatever findings it is that, that we're documenting. Photos and research, I think are very important. And even if there is no issue with the pediatrician, I would try to get, and I learned this from Dr. Boyd, still send that child's pediatrician your evaluation report. So they keep seeing your name, seeing your practice, seeing the findings, seeing it all. You want to be relevant to that practice.
And it does instill an accountability as well. If they're getting this information, it's kind of a call to action, right? Well, now what?
Right.
Dr. Miraglia, what's your experience with that?
Yeah, similar to Dr. Boyd, where resistance early, and it took a while to break through, and then I got to one of them. Then they opened the door and let me do a lunch and learn. I finally got into like a grand rounds for the pediatricians in the community. I brought stacks of research. I brought the articles. I brought all the photos. I brought as much as I could find on the ties, the releases, the myofunctional therapy, and even then, after spending, an hour on multiple sessions sharing all that out, I still have the naysayers in that group. They're very tough to convince. So it's almost like trying to make someone change a religion. And so I stopped trying for the massive group. There are a couple that are on your side, and even the parents. I try to work more with the parents. I've had the misfortune of having done the whole explanation, and you teach it all, but the parent will leave the office. They'll call like an hour later and say, I called the pediatrician. They said our child doesn't have a tongue tie. And I said, wait, you went right there? And they looked at it and they said, no, we just called up and they said over the phone they don't have it. So I said, does that make any sense? Does that make any sense to you? Your child hasn't been there in a year and they're telling you over the phone you don't have a tongue tie. They haven't even looked under the tongue. And that's what we're up against in the office. And sometimes, I can't win some of those battles with the pediatrician. So just finding one that you can work with and you building, some of these bridges are very long and you just keep putting a piece in place and a piece in place. And Brittany's probably got the great idea of sending a file to the office. You meet the child, here's your initial report, and then you can send your follow-up in however many sessions or months later that you made a difference. And then it's going to be in their file there. Hopefully they look at it and then they'll start seeing, well, look at this happening. It's a pattern of improvement. That's a good way to keep building the bridges. Yeah, I feel like it's going to be a slow road, but one day they have to get there. There's too many of us now growing, spreading the word, helping the kids. I feel like one day they've got to catch on.
One day, one sweet day. Hopefully we will.
Another thing I think that Brittany said and Ben reinforced, you recruit the parent as an emissary. You say, look, your pediatrician, he's great. But he didn't learn any of this. It's not his fault that he doesn't know it. And that's how I deal with orthodontists who tell people, oh, wait till they're older. It's not their fault. And then right away, you're just neutralizing things. You get the parent on board by just saying, tell the pediatrician how your kid is sleeping better, how they're breathing better since Dr. Miraglia expanded him and or her. And just those are things the parents start talking and they're advocating for their own child. And I don't know, that's just another thing you can do to get the child's primary care physician, PCP, pediatrician. We're PCDs. Remember that, primary care dentist, or primary care dental hygienist, primary care myofunctional therapist. This is a big deal at the American Dental Association that we have to assume our rightful place as primary care providers. So that's just another little tip. Get the parents on board.
Thank you. We have so many questions, Brittany. I'm so
I know I'm
thrilled. We're gonna
trying to type
I
them
know
right
we're gonna
now.
have to. I say this every time. Maybe we have to do one like every week or something. But it's really. I'm so happy about the questions and the involvement and the curiosity. There was one where I really wanted to share with everybody. And let me just see here. There was a good one here. They're all good, but is there one that popped out for you, Brittany, that you wanted to address? And I know we're talking a lot about the courses. Let's see. All right, let's just say a lot of people are wanting to take a course, a Myo course in the near future. They want to know more about that. So why don't we go ahead and review the courses that you do offer? And then I suggest we do another town hall based on Myo because this is a really hot topic.
I know we didn't even get through any of those other ones that came in upon registration.
I know. So, but I want to be mindful of everyone's time. So,
Yeah.
we're geeks. We love doing this. So we'll do it
Sure.
again. That's all. And I just want to be mindful of everybody's time. The Facebook group that was asked is the Myo Hygienist. So you can find a lot of information there. Also, Tooth Pillow has great resources on their website. Children's Airway First Foundation has great resources on their website. Please look at our free resources on Airway Health Solutions. You don't necessarily have to take a course to get educated and to screen. So this is open to everybody. But as a professional, if you learn about myofunctional therapy, it just really helps with everything you do because it's the foundation. It's the final why, right? It's like the last why, the root cause. So I find it fascinating, but I think we're all kind of geeky or else we wouldn't be here on a Wednesday night all together, right? So here we are. I'm going to go ahead and share my screen here and also honor that 50% off of all of our courses this evening, Myo courses, that is. Again, that's going to be good to midnight, and the code is AHS Myo 50. So write that down. It will expire at 11:59 this evening. So we do hope that you take advantage of that. We want to give a jump start because sometimes people are on the ledge of if they want to do it or not. There's a lot of fear in trying something new. Perhaps it's not a good time monetarily, so we want to try to help with that. But we think that this is a perfect start for you to jumpstart your career as an allied health professional and also as a dentist, pediatric dentist. Brittany, why don't you tell us a little bit about the intro course here? Tell us a little bit about it. You designed it, you execute it. We have wonderful reviews on it. You have a high NPS score of like 100 or something like that. Incredible, off the charts. So tell us a little bit about your course. I know this is your baby, so I'm going to go ahead and let you kind of talk about the intro course.
Yeah, absolutely. So it's an 8-week course. However, when you do register for the course, you are given access to pre-learn material. There's about 9.5 hours of pre-learn content. Some of those are lectures from Dr. Boyd and Dr. Miraglia, which is super exciting to be able to, anytime you get the chance to listen to Dr. Boyd and Dr. Miraglia, I would definitely take advantage of that. And then what happens is it's a mix, hybrid of live and virtual. So what happens is for those 8 weeks, each week a lecture gets released on a Wednesday, and you are able to watch that lecture in your own time. Now, I love this because if I could have gone back to my first Myo course and had a remote control and like was able to pause, rewind, slow down my instructor and be able to write all the notes that I wanted to write, what I would have done to be able to do that. So being able to do it whatever quiet time is for you, whether that's when the kids go to sleep or a Sunday morning or whatever the case may be. And then that following Monday, we meet for a live virtual Q&A. All sessions are recorded. So again, if you can't make it, no big deal. But those Q&As are invaluable. I mean, what we dive into, we kind of like, pick apart basically what that lecture was about and questions that maybe, you didn't think to ask, but one of the other participants thought to ask. It's just really incredible. The Q&As are my absolute favorite. One of my other favorite parts of the course is week 8 is what we have a case study presentation week. And I love this because one of the scariest things after taking a myofunctional therapy course is seeing your first patient and being like, oh my God, I don't know what to do. I don't know what I'm doing. So what I do is I've basically created your case study presentation for you throughout our journey together. So at the end of each lecture, you have a little mini homework assignment. It's not a homework assignment you have to give in, but it does help you build that case study. So you are already leaving the course having started your assessment, your evaluation, your treatment planning, your troubleshooting, referring the patient, to whoever, they need to be referred to. You're already starting all of that. And at the end of the course, everybody gets a 15-minute time slot to present their case study. You get my feedback. You also get to hear all the other participants' case studies. So that week in itself is worth, you can't even put a price tag on that, honestly. So that's my favorite part of the course. We have continued support after that. So we have our alumni Facebook group where I have quarterly Q&As. We have a WhatsApp group where we can chit chat on the daily, any questions that you have, that you don't want to wait to the Q&A to ask. One of the other biggest opportunities with our AHS School of Myo course is job opportunity and placement within Tooth Pillow. So taking our introductory course makes you eligible for an internship with Tooth Pillow, which is fantastic. It's also a paid internship. So you are getting patient experience right off the bat. That's also one of the hardest things when you graduate a myofunctional therapy course. Like you want to gain the experience, but where are you getting these patients from? The patients are provided for you from Tooth Pillow. You are also being mentored by either myself or our other director of the myofunctional therapy program at Tooth Pillow, Laura Eckhart. She's fabulous. So you're getting that one-on-one mentorship. You're getting that patient experience. You're building that confidence. And then, again, at the end, there's always an option for, permanent job placement as well.
Yeah, and that's really exciting, that we can, once we have the applications and the interns and they gain the experience, then they're going to take priority to when we need more myofunctional therapists to do the work at Tooth Pillow telehealth platform. So Brittny, why don't you just explain that a little bit of how, the need for that is rising.
Oh my God. We need myofunctional therapists. Yeah,
Yes.
we are, we're looking every month, we're hiring new myofunctional therapists. It's completely virtual, which is great. It's flexible, as far as your schedule. We understand a lot of you are still going to be, if you're a dental hygienist, still going to be doing some, hygiene days, hygiene hours. So finding that flexibility in your schedule. And then obviously the goal, if it's your goal, to get out of clinical hygiene and more into myofunctional therapy and you like the virtual platform, then I think that Tooth Pillow could be a really good fit for you.
Yes, and one of the questions are, the course, does this go towards your COM? So let's talk about that a little bit also.
Yes.
Yes.
Yes. The answer is yes. So once you finish the course, you will receive a CE certificate stating that you took a 28-hour introductory myofunctional therapy course. You need that CE certificate to present it to the IAOM to be able to apply for certification. Also, just a random fact about me, I don't remember if this was in my bio or not. I'm on the board of the IOM, and we have some really cool stuff in the pipeline happening for myofunctional therapists in our community. So I'm really excited to be able to, empower myofunctional therapists worldwide through that. But the short answer is yes, you are able to take your COM. For anybody that doesn't know what that is, it's Certified Oral Facial Myologist. You are able to apply for that certification process afterward.
Perfect. Okay. And then let's talk about those myofunctional therapists who already took the intro course, and let's share about a little bit about the business success course.
Yeah. So if you're feeling like, you already took an intro course, but you're just struggling to kind of get your practice off the ground running, we have our business course where you come into, basically it's the business aspect of our intro course. So the way that it's developed, the later weeks of that 8-week course are where we hone in more on, safe practices, how to build your whatever you're going to build, LLC, sole proprietorship, all that jazz. How to basically get your practice off running, how to, network and get those referrals coming in, because of course we need patients. Excuse me. So we have that option as well. And one of the other weeks that I included in that, because just feedback from, past myofunctional therapists, we're always looking to learn new and exciting exercises that we can add to our toolbox. So you will gain access to our 50+ library of myofunctional therapy exercises and techniques.
So who is this course perfect for? Someone who already took an intro course? Would this be a good next step?
Yeah, definitely. Definitely. The business course, you definitely have had to have taken an introductory course first because you need all of those foundations. And again, it's more for that business side of it to really get your practice off running.
Okay, and let's talk about mini myology. We launched this last year. We had great reviews as well, a great success. So tell us about another one of your babies, the mini myology.
Yeah, so this group is so fun to work with. So again, we talked about this in the beginning of the Q&A, those children that aren't quite ready for a full myofunctional therapy program, we still can get them started. We can start to work on those muscles and provide that, that nice solid foundation. And the mini myology course I love because it gives you different tips and tricks. It's very different than treating even a 7-year-old or a 10-year-old, right? If you're treating a 2, 3, 4-year-old, it's completely different. So giving you those strategies to not only handle the patient themselves, but also what comes along with the patient, the parent and the caregiver, because that is half of your battle. So that course is really fun, going over even, changing up exercises and how to make them just interactive and kid-friendly and engaging, because engagement is the hardest part with this age group.
Great. We just had 2 signups, so I know this could fill up actually. So it's the midnight, everything expires for the intro course, and you can take more than one course this evening. So if you wanted to kind of get all of your myo for the year, you can, and we will work out with you a way to access this at your leisure. But we just wanted to get everyone on board and get the information they need and have it accessible and affordable for them. So let's talk about your newest course, is Mastering Tongue-Tie Readiness. Why don't you tell us a little bit about this 10-step clinical process and who would benefit from this?
Yes, I love this course. This is also for existing myofunctional therapists. Tongue ties are a very a gray area, I guess you can say, right? There is no one type protocol that you can follow. Every patient is different. When they're ready for the release is different. Some cases can benefit from just doing myofunctional therapy, and we end up not actually having to even do the release. So when it comes time to assessing treatment planning, reevaluating, I kind of just developed this 10-step protocol that takes you from the very beginning of seeing that patient through the very end of their treatment. So going over active wound management, different adjuncts that I kind of bring in, to ensure optimal benefits, optimal success, optimal range of motion. That course has become one of my very favorites, because it's always a question I get, like, I don't know, is this a tongue tie? Do we have to have it released? When do I know when to release? How many sessions do I have to do before? So those are all questions that will be answered throughout this course.
Right, and it's up to 5 hours of live CE. So again, tonight, I feel like almost like I'm on JVC or something. You get 50% off tonight. Going. So we've never done this before, so it's kind of fun. And then we have our pediatric mini residency, which isn't 50% off, unfortunately. But we just wanted to let you know about this if you're looking to incorporate pediatric airway health integration. This is the go-to course. I hear so many times that doctors wish they took this course first because it kind of sets them up for success. Some people end with this course in pediatrics and then others move on to our courses and other courses, but it's a great first step. So please consider that. I'm not going to go through all of our courses, but I will mention Dr. Boyd's because he's on tonight too. And if you really want to focus on the little ones, so it's 2 to 6, this is the course to go to. And he would like everyone to take Dr. Miraglia's course as a prerequisite because he dives right in. So it's not to be difficult. It's just we want you to have the best learning experience. So we need to have a foundation of Dr. Miraglia's course first, followed by Dr. Boyd's course, and then you'll be ready to roll and help all of these kiddos as well. We do have our sleep apnea screening course, so please check that out, as well as a new course about strategies for pediatric behavior management. So if you are treating the little ones, this is great for all healthcare professionals. So we're really thrilled to have Sharon Moore on our faculty. And we also have the dynamic and beautiful Susan Maples. She's has an amazing course for the doctor and the team. So please take a look at that elective on our website. And I'm thrilled to actually announce our Airway Palooza lineup. This is the first time we're announcing it. You can see, I'm not going to read all the names, but I'm sure a lot of the faces look very familiar to everyone. Of course, we have our AHS faculty who will be presenting, and also you can see other keynote speakers joining us. So it's going to be in Fort Lauderdale, October 17th and 18th. It's sold out the last 2 years. So please put this on your calendar, plan for it. It's pretty much all inclusive, meaning the meals and everything under one roof. It's a celebration and it's an inspiration. So hopefully you'll join us and take advantage of the $200 coupon code with AP Murphy off of the registration. So can't wait for this one. It's nice. This is the first time I've seen all these faces together. So it's really, really exciting. And we hope to see you there. Okay, so there are steps to get involved with Tooth Pillow. So all allied hair healthcare professionals. So,
Lauren, you're not sharing your screen. Are you meaning to share your screen?
I mean, yeah, I'm meaning to share.
I'm like, I don't see faces.
No, you saw no faces? Oh my
No
goodness.
faces.
Okay. Holy moly. Okay, let's see. Do you see this?
Yes.
I'm gonna have to show the faces now.
Yeah, let's see the faces.
Hold on. See the faces?
We see the faces.
Okay. But great faces, right? These are the the life changers, the airway health advocates, the airway avengers, if you would, all under one roof. So this is our marvelous lineup, and thank you for sharing that with me. You can see we have our faculty as well as other speakers. So please put that on your calendar. It's going to be an event to remember. Okay, so you can see the QR code?
Yep.
Wonderful. So we have our allied healthcare professionals. We have an application if you want to get involved as a screening provider. We are going to do our second cohort. So if you've already filled out this application, we haven't forgotten about you. Being a startup company with Tooth Pillow, we're just getting all of our systems in line, and you will be hearing from us early next week. This is for our second cohort, which we'll be releasing probably towards the end of Q1. So fill out the application. We'd love to hear from you, get to know you a little bit better, and set up a call to see where you may fit and how you want to be involved with Tooth Pillow. So all the allied healthcare professionals, this is the QR code. And then doctors, you can use this QR code, and this will also be in your follow-up email of how you can get involved with Tooth Pillow. And I want to thank everyone from the bottom of my heart from attending tonight. We really appreciate all that you do. And we look forward to seeing you next time. I think February I might get Dr. Boyd back on for it's Children's Health Month. So we'll talk about that, Dr. Boyd. But until next time, you keep coming. We'll keep showing up and providing education and help people breathe, sleep, and thrive. Thanks again, Brittny. And don't forget to sign up for those Myo courses. Good night, everybody.
For having me. Good night, everybody.